Hi everyone. We are going to discuss the last module of chapter 8, how do organisms reproduce. So in this topic, we are going to discuss the process of fertilization, zygote formation, pregnancy, childbirth, contraception, and STD. So fertilization. So fertilization means it is the process of formation of zygote by the fusion of sex cells. So in human beings, the male sex cell is sperm and the female sex cell is ova. So as a result of intercourse or coitus, the male deposits the sperm into the vaginal tract of the female. As soon as they enters into the vaginal tract, with the help of tail, it can swim through the uterine cavity and ultimately it will reach the fallopian tube, or we can say oviduct. Simultaneously within the female reproductive organ, that is within ovary, if ovulation takes place, that means the release of ova takes place, the ova will be slowly driven into the fallopian funnel and then into oviduct. There, at that junction between, or isthmatic junction, we'll say, oviducal region, the sperm will fuse with the egg. So the process of fusion of sperm with the egg within the oviduct, we can say fertilization. And as a result of fusion, immediately they'll form a single cell. That single cell is called as zygote. So zygote is the first cell of the embryo and it is a continuation of next generation. Soon after the zygote formation, the zygote will divide. The division of the zygote is called as cleavage. So first it will transform into 2-celled stage, 4-celled stage, 8-celled stage, 16-celled stage, and 32-celled stage. By the time, slowly they will reach into the uterus. So when they reach 32-celled stage, they will get implanted, or they will get fused with, or they will rooted within the uterine cavity. So the implantation of the embryo within the uterine cavity, that marks the beginning of pregnancy, or that term is called as implantation. So once it is sticking onto the uterine wall, gradually the uterine lining, the innermost lining of the uterus, as well as it will infiltrate the extra embryo. That means the embryo will be surrounded by a certain membrane. That membrane will infiltrate into, or will be pierced into, the uterine cavity. There the uterine lining also will take part, and that will marks the establishment of placenta. So this placenta is actually the connecting link between the fetus and the mother's blood. So from mother's blood, all the needed nutrients such as glucose, amino acids, the hormones, the antibodies, all that needed nutrients, oxygen, etc., from the blood of mother to the child, it can be exchanged. So hence placenta is acting as the nutritive tissue, and at the same time it is also an endocrine gland, because this placenta secretes certain amount of estrogen, progesterone, and human chorionic gonadotropin, then human placental lactogen, all these things which is essential for the support development of the, or which supports the fetal growth. So it is a nutritive tissue, because through that only the nutrition is provided from mother to the fetus. Same way, it is also providing hormones, which is essential for the development of the baby. And that will provide extensive surface area because they are arranged in the form of finger-like structures and they will enter. So through that surface area, the exchange or diffusion will take place. And the moment where the placenta is established and the fetus is attached to the maternal body or maternal uterine cavity, then that period marks the gestation period. That means the pregnancy period, the beginning of pregnancy. And the embryo will get a chance to continue and to complete its full term, that is approximately 9 months within the mother's womb. That period is called as pregnancy period or gestation period. So all these changes occurs when the egg is happen to meet with or happen to fuse with sperm. Suppose at the time of ovulation, if there is no sexual intercourse, or if the sperm is not entering inside, or sometimes the intercourse is happening not in the anovulatory period, or we can say when the ovulation is not taken place, that time the sperm will die off. The same way, if there is no sperm, means ova also will die off. So if egg is not fertilized, means what all preparatory stage the uterus have undergone to receive the fetus. That means it will inner lining, it is called as endometrium. The inner lining of the uterus, to receive that one, more and more inner lining, and it will become more thick and it is spongy in order to support the embryo. But that particular month, if there is no implantation, if there is no fertilization has taken place, if the egg is not getting a chance to meet with the sperm, then there won't be any zygote formation. So all those preparatory period the uterus have undergone, it will, the inner lining, the glandular secretion and the blood vessels and all will detach. It will break and it will be peeled out. The entire lining and the secretion and the blood, etc., will be peeled out through the vaginal opening. So it will, the lining breaks and it comes out through the vagina along with blood and mucus. So this process is called as discharge of the inner, if the egg is not fertilized, if the implantation is not taken place, means the whole inner lining will be peeled out. That process is called as, in the form of bleeding through the vagina, that is called as menstruation. So this process, this cleaning of uterus will take place every 28 days. So the reproductive cycle of a healthy female, we can say the duration is 28 days. So that particular period, they have to maintain a sexual hygienic way of life. Otherwise, it will invite all the unwanted germs and infectious conditions, etc., etc. So cleanliness is very important aspect at the time of menstruation. Then, not only that one, sometimes if we are not leading a healthy sexual life, multigamous mode of or polygamous way of life, that means than one partner keeping many partners at a time, and there will be lot of risk factors are involved in such type of livelihood. Here they will invite that type of lifestyle may end up with unhealthy or contraction of sexually transmitted disease. So it is very important. Same like this one itself, the reproductive health, the study of reproductive health, how can we maintain the reproductive health is also very important. So what do you mean by reproductive health? Reproductive health means the total well-being in all aspects of reproduction, physical, emotional, social, and behavioral. So in any of this one, if the person is not fit, means we can say he is not healthy in the field of reproduction. So physical means if his reproductive organs are not functioning, if the sperm is not producing, or if the ova is not producing, if the motility of the sperm is not there, all these can be declared as an unhealthy character. Sometimes emotional. Some people, they will be emotionally, may not be properly balanced, so they may treat their opposite sex in a different way, as an object of utilization, without giving due respect, etc. So that is another type. And sometimes some perversion, sexual perversions, abusing the children, and leading multigamous or polygamous lifestyle, reckless behaviors in the case of sexual act. All these things also is coming under a kind of unhealthy behavior. The next one, it is social. The sexual expressions, if it is not socially accepted, some people, they will show exhibitionism. That means their private parts they will show in front of the public. Through that, they will get sexual satisfaction. Sometimes they will behave in an awkward manner when they are traveling in bus in crowded places to the opposite sex. So socially, there are certain social norms we have to follow. And if they are deviating from that, that is called as social unhealthy behavior. Very rare cases, behavioral patterns also. The person's behavior itself, the way he is treating his opposite sex, eve teasing, and sometimes the opposite when they are taking bath, voyeurism will say, they'll peep into, and like that, so many other characteristic behaviors if they are showing, means they have to be dealt with treatment. They have to consult the psychiatrist and they have to take the medications. So all these field, generally all these behavioral disorders, social disorders, emotional disorders, and physical disorders and all have to be consulted with a medical practitioner. And as I said, if you are not leading a healthy behavioral or healthy approach towards the sex, means then automatically sometimes there will be a chance of contracting sexually transmitted disease, or we can say STD. So they are broadly classified into two categories, that is bacterial STDs and viral STDs. That means the sexually transmitted diseases which spread through the bacteria, it is called as bacterial disease. So typical examples are gonorrhea, syphilis, etc. So the main symptoms there are itching, swelling in the reproductive area. Sometimes blood also will come out. Smelly discharge will be there. And it can spread from one person to another if they are not using protective measures. Through the body fluids, it can spread. Through sexual contact mainly. Then apart from that, there is viral disorders also. So viral disorders, mainly we'll say genital herpes, warts, AIDS, hepatitis B. All these are the different types of viral sexually transmitted disease. Here also the virus is causing, or through the sexual transmission, sexual contact with multiple partners, from one person to another person, easily it can spread. Out of this, AIDS will end up with the death of the person. It is highly serious condition only because the person's immunity, AIDS means acquired immunodeficiency syndrome. So if the virus is attacking our body, the AIDS virus or HIV virus, when it attacks our body, our immunity power will be suppressed, and that person will get all the communicable diseases such as tuberculosis. Then apart from that, sometimes typhoid, pneumonia, influenza, like that, all the opportunistic disorders, because our immunity power is totally lost. So a collection of diseases will be affected for that particular person. Hence it is called as syndrome, acquired immunodeficiency syndrome, because our immunity power is totally lost and death is inevitable. All the AIDS patients finally, ultimately, they will die because there is no curative medicines or vaccines or any such things. So far, it is not discovered. So how can we avoid? Because AIDS and hepatitis B, it can spread through sexual transmission as well as through blood donation, blood transfer. When you are receiving the blood from an unknown person, the chances are, these factors are very high. So through the body fluids also, the hepatitis and AIDS can spread, not merely through the sexually transmitted disease. Apart from that, receiving the blood and through the body fluids and all, it can spread. So we have to be very careful. How can we avoid such diseases? Because through the body fluids, if it is passing through, sexual transmission is very, through the sexual contact, it can be transmitted. So in such cases, to a certain extent, use of condom prevents the sexually transmitted disease, because that latex rubber sheet will prevent the union of body fluids, that means semen, with the solution of, or with the secretion of, mucal secretion of vagina. It will prevent the meeting of this body fluids. The next topic, it is contraception. So what do you mean by contraception? It is the avoidance of pregnancy. How can we avoid the pregnancy? By avoiding the meeting of ova and sperm, or else we can say preventing the fertilization. There are different methods for contraception. Physical method, chemical method, hormonal method, surgical method. So how can we classify each and every one? Physical method means by keeping any barrier by which the union of sperm and ovum is, the meeting is prevented. Typical examples which come under that category is condom, cervical caps, and diaphragm. Condom is mainly used by male, and more or less the similar physical barrier which can be used by female is cervical caps and diaphragm. It is fixed in the cervix region so that the semen will not enter into the genital tract of the female. The second method is chemical. That means with the help of certain hormonal preparation, we can alter or we can suppress the speed of a movement of the ova or movement of the sperm, and the fusion chances can be prevented, or the formation of ova can be suppressed, ovulation can be suppressed, implantation can be suppressed. So different ways with the help of hormones, if we can, that is coming under the category of chemical methods. So the most common chemical method is oral pills. So what do you mean by oral pills? It is a hormonal preparation. Estrogen and progesterone. These are the two female hormones which will be administered orally, the preparation in the form of pills, tablets. And that will can make imbalances. And in that way, the ovulation and the survival of the ovulation and all can be suppressed. But they may cause, even though the ovulation can be, overproduction can be suppressed, they can raise many side effects like abdominal pain, excess bleeding, and sometimes sexual characteristics of the opposite sex can be expressed like that. Then the third category is intrauterine contraceptive device, IUCD. So it is the devices which are inserted into the uterus so that the uterus will reject or will prevent the implantation process. So the most common, it is copper T or loop. It is a copper wire. which can be inserted in the shape of a T, letter T, English letter T. It is placed in the uterus to prevent the pregnancy. So there are copper T, multi-load, copper 7, lips loop. Like that, different varieties are there. The main function is they will prevent the implantation of or the pregnancy when it is using. The last and the permanent solution for contraception is surgical method. That means with the help of surgery, the passage of the ovum or the passage of the sperm can be interrupted. So in males, that's a surgical procedure, the removal of vas deferens or the cutting of vas deferens or tying of vas deferens to block the entry of or the passage of the sex cells through the duct. It is called as surgical method. So in males, it is the vas deferens is either cut or tied to prevent the passage of sperm from the testis to the penis. So the insemination, semen formation will take place, but the semen will be devoid of sperms because the sperm cannot travel. Once it is vasectomy is done, it cannot pass through the vas deferens. In that way, the meeting of sperm with the ova can be prevented. So that procedure is called as vasectomy. In females, the fallopian tube is blocked or it is tied to prevent the transfer of ova from the fallopian tube, and then in that way the union of sperm and egg is prevented. So here the surgical, with the help of surgical procedure, the tube either cut or tied to block the entry of sperm to the ova or to the movement of ova to the sperm is prevented. So these are the main categories of contraceptive methods. So here it is a graphical record of what are the main types. Then in this one I forgot or one I left out, that is natural methods. All other things are artificial methods. So naturally we can avoid the pregnancy. That is, the first method is just before the insemination, the penis can be withdrawn from the vaginal tract so that the semen will not enter into the vaginal tract. So the semen can be discharged out just before the insemination. So there won't be any chance of sperm to meet with the egg. Then by nature, soon after the pregnancy, when the mother is lactating the child, that means feeding the child, because of her body is producing certain hormones, and that hormonal imbalance will suppress the ovulation. So soon after approximately 6 months, the chances of getting pregnancy is very, very rare. So that is called as lactational amenorrhea. The last one, it is periodical abstinence. So what do you mean by periodical abstinence? Means we know that ovulation is taking place approximately from 10 to 17 days of 28th cycle. Exactly when we are saying it is approximately on the 14th day, but sometimes due to many other stressful conditions or any other factors may influence, so 2 days before or 2 days after. That is why when we take 10 to 17 days, if the couple is not involving in sexual intercourse, if they are avoiding the sexual intercourse, then there won't be any chance of getting the pregnancy. So these are the different ways, and natural method, there is no side effects. All other methods, there can be side effects can be there. So all these are the different methods of contraception. When we move to the next topic, that is, in our country, there is a natural tendency that the female in the family, the member, the baby girl in the family, the whole society is considering them as the female people, the girls, as a burden to them. because they have to get married. They have to provide a very good amount as uh, the uh, amount for dowry. So normally, many northern states, they are generated a tendency to abort if they come to know the baby is a female. So the tendency to kill the female embryo or female fetus within the mother's womb as soon as they come to know that they are female baby, that is called as female feticide. And if it happens so, first of all, killing is a great crime. And second one, can topple the balance between male and female ratio. So how can we avoid such female feticide? We can give them an awareness to avoid the malpractices like female feticide and prenatal sex determination. We can find out with the help of a diagnostic technique. We can take the fetal fluid, the amniotic fluid, the fluid which surrounds the baby. And in that, the free cells can be observed, and we can find out whether her baby, in that baby, is it XX chromosome or XY chromosome. If it is XX chromosome, means it is a female baby. If it is XY chromosome is present in that fluid, then it is called as it is a male baby. But to find out if the baby is having any genetical disorder or not, the technique is withdrawing or taking the amniotic fluid and then detecting through the microscope if any lengthening or decrease in length or increase in length, or what one chromosome is additional extra, 46 normal, then if it is 47, or if it is lost 45, or like that anomalies, chromosomal anomalies, we can detect by studying the amniocentesis, that procedure. But one risk factor is that we can find out the sex of the child. But nowadays, legally, the government has banned the procedure, not the procedure as such, the declaration of the sex after this procedure. So the doctors should not reveal the sex of the child, otherwise sometimes it may end up with female feticide. So the prenatal sex determination is legal offense in our country so as to maintain the balance of sex ratio. So all these are the main topics we have dealt in this module, and with this we have completed the whole lesson. So study well. Thank you very much.